Boko Haram militants in Nigeria are increasingly using young girls as suicide bombers. A 13-year-old girl gave this shocking story about her recruitment and first mission.
My
father took us to the bush, which was surrounded by gunmen. I was asked if I wanted to go to heaven. When I answered, they said I have to go for a suicide mission, and if I attempted to run, they would kill me. So from there, we were sent to Kano. When we came to Kano Market, one of us said we should go separately, but I refused. After my friend detonated her own explosive vest, I was wounded.
Dominic Stolarow is UNICEF's Chief of Emergency Operations in Nigeria, and I spoke with him earlier from Abuja. Dominic, thank you so much for taking a few minutes to speak with us here on Arise America. Of course, we are aware of other terrorists, namely Joseph Kony in Uganda, using child soldiers, but the use of children as suicide bombers in Nigeria seems new to me. How long has this been going on, to your knowledge?
Well, as far as I know, this is not the first time this has been reported. And of course, UNICEF condemns any violence against children under any circumstances.
Have you been able to get, has UNICEF specifically been able to get into some of these areas that have had very high incidents of violence at the hand, most believe, of Boko Haram, speaking specifically of Maiduguri, where the 10-year-old girl was used as a suicide bomber?
Yes, I was in Maiduguri late last year. I went up there to support the response to the IDPs in the camps and the host communities. We've recently opened an office in Maiduguri in December, which is staffed and is operational, and is going to provide us with a great opportunity to try and scale up our response.
Can you give us an idea of the temperament, the mindset of the people who have called these areas home that are now dealing with this onslaught of violence?
Well, the number of IDPs has increased quite significantly over the second half of 2014. There was an interagency assessment that was done in May, which identified around 650,000 IDPs. And then we see now we have currently over 868,000, with 100,000 IDPs living in camps. So this has been the big change in the second half of 2014, was the increasing number of IDPs living in camps, whereas previously they were taken in by host communities where they had relatives or family relations.
And of course, when you say IDP, you're talking about those internal displaced people who are from that area but displaced from their homes. Because of this increase in the number of IDPs, can you sort of talk about then the living situations that they're forced to endure?
Yes, well, the displaced are certainly facing dire situation. They're facing a lack of food, they're in serious need of medical attention, suffering from malnutrition. Furthermore, they lack access to schools and medical facilities, which are two institutions targeted by the insurgents. And of course, children who arrive are also in serious need of psychosocial support as they arrive quite traumatized. We estimate that at least 250,000 children in Borno alone have been out of school during this school year. And a total of 338 schools have been destroyed, and at least 196 teachers and over 314 students killed in the 3 state of emergency states.
Dominic, can you, just by your experience, there's been a lot of criticism of the Nigerian government for not reacting, number one, or reacting effectively enough to stop this insurgency of Boko Haram. Has this increase in violence, you think, changed the government's perception of how important the violence is and what's necessary to stop it? Are they paying more attention now, in other words?
Well, we've been working with the government to try and respond to the needs of the IDPs, and certainly we have had a lot of cooperation. We have managed to access numerous areas, and in terms of some of the regular programming, for example, the polio campaign in September reached over 2 million people, 2 million children under 5 years old in both Borno and Yobe states in some of the very hard to reach areas. So we've had quite a lot of cooperation from the government in terms of emergency response.
Well, that is encouraging to hear, and it is an ongoing problem that needs a lot more attention. Dominic, thank you so much for your time and for bringing illumination to this important issue.
You're welcome. Thank you.
Dominic Stolarow, we do appreciate it.